Hello all, welcome to my PICO presentation. I'm Ivy Bringer, I'm a Bethel College nursing student, and I'm excited to speak on the topic of contraception education among the homeless. My PICO question as states, in the population of homeless women, how does the education regarding contraception use compared to no education on contraceptives affect rates of unintended pregnancies? Some additional context to help put this issue into perspective. Women and families represent 34% of the homeless population and are the fastest growing subset. It's important to acknowledge that there are homeless children out there, even if they aren't the ones we think of when we think of homeless people. Endless barriers make it very difficult for the homeless population to not only obtain contraception, but use it in an effective manner. The barriers don't end once a homeless woman receives birth control. Depending on the type, she will need education on how to store the birth control, education on follow-up care, and education on how to manage side effects. A recent study found that youth experiencing homelessness felt the discussion of contraception is like a different language and are largely unaware of how and where to access contraception. This is why, as nurses, it is so important to present information to our clients in a way that is comprehensible to them. A baby will not only set a struggling woman back financially, but it can also make it harder for them to find employment, go back to school, and obtain mental well-being. Planned Parenthood states that prenatal care alone can cost up to $2,000. The cues and quality indicators that my topic represents is evidence-based practice and patient-centered care. Education of the best current evidence, clinical expertise, and patient preferences helps the population of homeless women make an informed decision about contraception use. Patient-centered care. The homeless experience is unique to each person who has encountered it, and it is important to provide birth control education in a manner that is sensitive and empathetic to the individual. The research that is conducted over this topic focuses on three aspects that I feel to truly grasp the complexities of how and why this group needs education. So, contributing factors. Contributing factors as to why women either are choosing not to be on birth control or why this population tends to have more unwanted pregnancies versus their counterparts. So, survival sex. Survival sex in the youth engaging in sexual activities exceeds 20%. Survival sex is using one's own body to transact for basic human needs. Intimate partner violence. Intimate partner violence happens when a woman feels that she cannot negotiate whether condoms are used or about birth control with her partner. Resistance toward condom use, sex at an earlier age, and spontaneity of sex means not having a consistent place to engage in sexual activities, which results in activities seizing the moment and situations that result in being caught unprepared. Preventative health care is not a priority. When a homeless woman has other dire health care needs, the preventative health care is going to be pushed to the sides and not necessarily acted upon because they have other things that they're worrying about. And not even just them, they could also have prior children that have healthcare needs that are going to ultimately put contraception use on the back burner. Lack of side effects from contraceptives and the lack of resources to manage them. So a lot of contraceptives cause unpredictable bleeding patterns, and women don't have the resources to manage them, such as money to go buy pads or tampons. And then the barriers that go along with that is not necessarily having the money to buy the okay, so increased rate of rape and then engaging in sex while under the influence of drugs and alcohol. So the barriers that go along with this is transportation to go and get those types of products, transportation to the clinics, lack of services in that particular area. The woman is probably suffering from financial instability. Also, for follow-up appointments, having those same issues, and then consistent forms of communication and contact information. So with those follow-up appointments, how are you supposed to get a hold of that person? How are they supposed to have the correct documentation to bring to those appointments? And then a major theme throughout all the literature reviewed was lack of knowledge, and that's lack of knowledge about resources available, where to go to access those resources, and then types of contraception. So it's important to, when working with the homeless youth, to that we consider their environment, and when they choose a type of contraception, that we as nurses assess how well they are going to be able to maintain that type of contraception. And then we also need to educate about lower maintenance types of contraception, such as Nexplanon and the IUD. Those would be two forms of lower maintenance contraception that would be a little bit more compatible with the homeless lifestyle. And then those types are also more effective. Their effectiveness rates are higher than what the pill or condoms would be. So there's also costs that go into those, different costs between different types of contraception, and then routes of administration. And we also need to educate on misconceptions such as birth control causes infertility. So the recommendations for the issue about homeless women and contraceptions would be same-day STI screening. Recommendations from multiple authors throughout the literature were to implement same-day sexual transmitted illnesses screening to make it easier for women to obtain birth control in one appointment, instead of having two different appointments where they, on this one, test you for STIs, and then on the next one are able to set up an appointment. If you could just do that in one appointment, it would make it easier so that women don't have to find transportation and have childcare for previous children that they have. And then adopting the Wahine Talk program. So in a 2018 study, a Wahine Talk program was implemented in the community, and it is an incentivized healthcare program that connects homeless youth to a multitude of benefits. This 20-week program had several stages that the participants navigated through, with the idea to acclimate the participants, become close and trusted by the participants, address the participants' fears, and help the participants decide to receive birth control. The longer the participants stayed in the program, the more data boosts they were given on cell phones that were provided as an incentive to start the program. This program gave the participants access to basic needs, helped build a sense of autonomy, and gave participants a chance to feel heard. So this program was all about connecting these youth to a whole bunch of aspects within this program that ultimately helped them lead to a choice to get them to a place where they felt that they could choose birth control. Further research also needs to be conducted to assess women's knowledge about sexual health resources. That is a very complex issue, because this topic and this population is, one, very personal and sensitive, and two, this population is very hard to reach. And then also studies conducted on the population of homeless men, because few studies focus on men's sexual health, which makes it difficult to understand how they perceive and participate in using birth control. And the lack of studies on men's sexual health kind of suggests that more of the responsibility is falling to the female's party. So in conclusion, breaking down the many barriers that stand in the way of these women receiving basic health care would decrease the rate of unintended pregnancies. The ultimate goal is to provide education so that women feel inclined to protect themselves against unwanted pregnancy. Emergency department nurses, clinic nurses, and community outreach nurses are best suited to assess this population, because these types of nurses are the ones that are most likely to come in contact with this population. And in providing empathetic care from a welcoming hospital staff, the healthcare system can already seem daunting enough for this population, and they don't need to come into a place and feel judged. They should get care just like everybody else, as they should. And then also starting a conversation with them, just as if you would at the end of your assessment ask, have you received your flu vaccine this year? Just making sure that you are taking the time to account for their whole healthcare being. And that is all I have. Thank you.